Hi, I am Asad and welcome to my YouTube channel. So in this video I will tell you what is US insurance and benefits of insurance. So first you can open your any browser in your laptop or mobile and go to search bar and type here USA insurance and type here what is health insurance USA and into the press and press the enter. Now you can go health insurance in the United States Wikipedia on this site. You can go on this site and click on this. Here is a lot of articles and its complete details about insurance. Now health insurance in the United States is any program that happens for medical expenses. Whatever through privately purchased insurance, social insurance or a social welfare program funded by the government. Synonyms for this usage include health coverage, health care coverage, and health benefits. In a more technical sense, the term health insurance is used to describe any form of insurance. Now you can go and here is the complete detail about benefits of US insurance. In addition to medical expense insurance, health insurance may also refer to insurance covering disability or long-term nursing or custodial care needs. Different health insurance provide different levels of financial protection, and the scope of coverage can vary widely, with more than 40% of insured individuals reporting that coverage. Those without it, however, high cost growth continuously unabated. National health expenses. Here is contents. You will see enrollment and unsecured. So number one, trends in private coverage. Number two, trends in public coverage, and number three, state of unsecured, and fourth, the social safety network, and 1.4.1 death, and 1.4.2 reform, and 1.5 under insurance. Number two, history, and 2.1 the rise of employer sponsored coverage, and 2.2 Care Mills Act, and 2.3 state risk pools, and 2.4 towards universal coverage. And number 3, here the number 3 details state and federal regulation. 3.1 California and 3.2 Massachusetts. Number 4, public care and coverage. 4.1 media care. 4.1.1 media care advantages. 4.1.2 media care part D, and 5.2 Cobra coverage, and 5.6 health care market and pricing, and 6 other types of health insurance non-medical. And here is the enrollment and the unsecured. Gallup issues a report in July 2014 stating that the insurance rate of adults 18 and over declined from 18% 2013 to 13.4. Now you can go some time you can see The social safety net. The social safety net refers providers that organize and deliver a significant level of health care and other needed services to the unsecured. And here is the detail of death. Since people who lack health insurance are unable to obtain timely medical care, they have a 40% higher risk of death in any given year than those with health insurance, according to a study published in the American Journal of Public Health. The study estimated that in 2025 in the United States there were 45,000 deaths associated with lack of health. Here is the detail of reform. The Affordable Care Act of 2010 was designed primarily to extend health coverage to those without it by expanding Medicaid, creating financial incentives for employers to offer coverage. Okay, and requiring those without employer to public coverage to purchase insurance and newly created health insurance exchange. And now you can go and here and see its history details. Accident insurance was first offered in the United States by the Franklin Health Insurance Company of Massachusetts and founded and consolidated rapidly soon thereafter. And see, while there were early experiment sickness coverage in the US effectively dates from 1890, the first employer-sponsored group disability policy was issued in 1911, but this plan's primary purpose was replacing wages lost because worker was unable to work, not medical expense. And here are the details of the rise of employer-sponsored coverage. Some of the first evidence of compulsory health insurance in the United States was in 1915 through the Progressive Reform protecting workers against medical costs and sickness in industrial America. Prior to this, within the socialist and the progressive parties, health insurance and coverage was framed as not only an economic right of workers' health but also as an employer's responsibility, and eligibility healthcare was in the context centered on working class Americans and labor unions. And you can click on scroll down button and you will see the details of Care Mills Act. Now I can tell you what is Care Mills Act, and I will share with you complete details about Care Mills Act. Still, private insurance remained unaffordable or simply unable to money, including the poor, that employed and the elderly before 1965. Only half of seniors had health care coverage, and they paid 3 times as much as younger adults, while having lower incomes. Constantly interested in creating public health insurance for those left out of the marketplace. Now you can click on scroll down button, and here you will see two definitions of about insurance. One is state risk pools. You can see here first definition state risk pools, and second towards universal coverage. Now I will tell you about state risk pools. Now I can start this topic. Prior to the Patients Protection and Affordable Care Act. Oh, sorry. Okay, private health insurance to purchase a state sponsored health insurance plan. Now you can check efforts to pass a national pool were successfully for many years with the patients protection affordable. Now you can see two definitions of about health insurance. One is public health care coverage and second is media care. Second is Medicare. Now I will tell you what is public health or coverage. Public programs provide the primary source of covering for most seniors and also low-income children and other families who meet certain disabled individuals. Medicaid founded jointly by the federal government and states. And here's the second detail about Medicare. Now you can go in Medicare. Now I will tell you about media care. In the United States, Medicare is a federal social insurance program that provides health insurance. Here is the detail about California and in 2027 85% California. What is California? In 27, 8 to 7% California had some form health insurance. Services California range from private offering HMOs post to public program media and media care advantages. What is media care advantages? And this this article I will tell you uh, media care media care for D. Health Insurance United States. Here is details of blurring data and now you can check their trends in the private coverage, trends in public coverage, status of the internet, the social safety net. And here is the detail about status of the uninsured and 2021 study found there were 2.1 million. Now you can go scroll down and here is the details about death. You can see and complete read this some lines and you can know what is death in insurance. Reform repeal on the individual mandate. What is history of central processing, internal processing, state risk pools, photo to the partner, patent protection and affordable care act, effective from 2014, and states 34 states offer guaranteed insurance risk which enable individual. You can see this article. Open tab and new tab, open picture and new tab. Okay, you can see here California employer. Check this article, check this table. Rise of managed care in US. ठीक है. Okay, rise of managed care in the US. Year 1991. Conventional plans 14%, HMO 30, 27%, POS 35%, POS plans 40%, HDCP 0. Now you can go scroll down and network based manager care. What is network based managed care? Many managed care programs are based on a panel or network of contract health care providers. Such programs typically include a set of selected providers that furnish a comprehensive array of healthcare services to enrollees. Explicit standards for selecting providers, formal utilization review and quality improvement programs, and explicit or preventive cure, and financial protocol. Other managed care techniques. Other managed care techniques include such elements as disease management, care, case management, wellness, and blurring lines. Now you can click on scroll down button and go to this site and Medicare supplement coverage Medigap, hospital indemnity insurance, scheduled health insurance plans, dental insurance. What is dental insurance? Dental insurance helps pay for the cost of necessary dental care. Few medical expense plans. Vision care insurance, specified disease, accidental death and disablement insurance. AD and AD insurance is offered by group in users and providers benefit in the event of accidental death. It also provides benefits for certain specified types of bodily injuries or limb or loss of sight when they are the direct result of an accident. Check this. See also general health economics, national health insurance, public health. Reference, you can check this. Thomson, Allowance, Lige, and external links. Now you can go back and you can click on this. How US health insurance works. In next video I will tell you how US health insurance works, Warden Health Services. Soon I will create this video, and in this video I will complete detail about how US health insurance work, Warden Health Services, and the way it typically works as a consumer. You pay as front premium to a health insurance company, and that payment allows you to share risk with health insurance. USA government. US health insurance guide to the US healthcare system. Understanding insurance. In the next video I will tell you about understanding insurance in the US. Explained. I will complete and give you all details about understanding insurance in the US. Healthcare government get 2022 health coverage, health insurance. Athena health insurance plans. How much does health insurance cost? Price factors. How much does math health insurance cost in the US? Insurance USA Health. Now my topic is complete, and today video is close on here, and in next video I will create a complete detail about how US insurance works. Now give me some time. Take care and Allah Hafiz.